joining us for another segment of Ask a Therapist. Today we have a returning guest, one of our favorite guests, Dr. Raymond Scott. And today Dr. Scott is going to be informing us a little bit about PTSD, one of the topics that I know that a lot of you may be interested in. So we'll be discussing some things about PTSD, the symptoms, treatment, and how therapy works for clients who may be suffering from that disorder. Also, I'd like to show you something. Dr. Scott just presented me with his postcard, which has his information about the practice, and it also has Chinese symbol here that I believe is this your name in Chinese?
Yes, it is.
Okay. Well, exactly what does this mean?
Okay, so my name in Chinese is Pinghua.
Pinghua?
Pinghua.
And what does Pinghua mean?
It means gentle wisdom.
Gentle wisdom. Isn't that an excellent relation with the name and the symbol? So I just wanted to show you that because it was just presented to me. And yes, definitely gentle wisdom and much wisdom, Dr. Scott. Okay, so as I said, Dr. Scott has been a guest with us before, but if you'd like to give a brief introduction of yourself to the audience, just to remind them of your background and what you do.
Sure. So I'm a licensed clinical psychologist. I've been in practice for about 17 years, but only for the past year here in St. Louis. My office is located in the central west end of the city, and I treat a variety of disorders, and again, PTSD tends to be one of my specialty areas.
Okay, and with PTSD being a specialty for Dr. Scott, I thought it appropriate to ask him to come back and especially address this disorder for some of you that may have family members or you yourself may be experiencing the symptoms, because often we associate PTSD with veterans and maybe just the war fatigue. But as you'll learn, it addresses a larger and wider spectrum of clients and disorders. So, Dr. Scott, could you first of all start by giving our audience a definition of PTSD and what it means?
If a person experiences events that are really what we call scary or shocking or dangerous, it can lead them to have a traumatic sort of experience, and that traumatic experience is usually can be the foundations from which PTSD symptoms will arise. Different situations such as, let's say, the death of someone that's very close to you, being in an accident, experiencing sexual abuse or physical abuse, violence. There's a lot of gun shootings going on now. And whether it's in a single event or in a school event or a mall event, so the individual may experience PTSD, but a group itself may also experience PTSD. And so one of the things that we look for, there's 4 categories of symptoms that become very important in terms of diagnosing whether or not someone actually has PTSD.
Okay. Okay, so, and we'll get into those 4 symptoms a little bit more as we move forward. But I just wanted to make sure that everybody, sometimes we assume that everyone knows exactly what PTSD means. What PTSD stands for is post-traumatic stress disorder. So there's a disorder as a result of the trauma that they've suffered. So, okay, so you mentioned there were 4 symptoms. Now, when we get into possibly being diagnosed with PTSD, what would be some of the symptoms that a person would look for?
Okay. So,
Excuse me.
the 4 categories include, the main one is re-experiencing the trauma. And re-experiencing can take the place of having flashbacks, where you're actually cognitively and consciously transported back to that very traumatic event. Or it can be in the form of dreams or nightmares. Okay? So there has to be at least one re-experiencing event to qualify. There also has to be one event of avoiding. And avoiding is, let's say, not wanting to return to, let's say, the scene of where the trauma took place. Not wanting, let's say, if you were in a car accident, not wanting to drive a car, for example. or even trying to push away the very thought about the event itself. So you have to have at least one re-experiencing event, one avoidance event, and then the third category is what we call arousal. And arousal would be many times being hypervigilant because you didn't have control over when it happened suddenly to you. So there's this feeling of always having to watch and scan your environment to make sure you're safe. And as a result of that, there's a lot of tension, there's a lot of anxiety because you're not sure. Okay. And so you can be startled very easily. You know, just sounds can make you startle and become afraid. So, or again, that can be that hypervigilance, that on guard sort of feeling, or again, just this general sense of just being anxious. So you need two of those symptoms, and then the final category is what we call cognitive and mood categories. And many times people who have been in a traumatic experience will not remember it exactly the way that it happened. So, for example, let's say someone was sexually abused, and they would remember it in the sense that maybe they did something to cause themselves to be sexually abused. And as a result of that, they may then feel like, I should have done something. So they begin to feel guilty as if they brought it on themselves. So that's a distorted emotion because of the cognitive distortions. Okay, all right. Or again, because of the fact that they are unable to remember it completely, they many times have difficulty, sometimes even understanding why they're having the traumatic symptoms as well.
So they disassociated from
in
the
some
event
way, yeah.
in a way.
Disassociation is a common factor that occurs with traumatic disorders. So again, as long as those symptoms are present in all four of those categories for at least a 1 month period, PTSD may be diagnosed.
So if they haven't had these symptoms consistently for at least a month, then that would not be considered PTSD?
That would be considered acute stress disorder.
Okay. So I see. There's another then diagnosis that's associated with their symptoms until the whole 1 month consistent symptoms exist. Okay.
Yeah. And one of the reasons that that's important is the symptoms of PTSD sometimes will go away very quickly. I mean, they can be profound, but they can go away within a couple of weeks for some people. So that's why they have the distinction. If it doesn't last for a month, and that's not uncommon, then that was an acute stress disorder.
I see.
Whereas PTSD is considered much more long-term, and it's much more severe because of the length of time.
Sure. Okay. So with, you mentioned associated disorders. Would there be other associated disorders that would be consistent with a person that's having those symptoms, the PTSD symptoms?
Yes. Quite often people who have experienced trauma will also experience panic disorder. So they will have panic attacks, and similar to the trauma itself, which came out of the blue, that's what happens with panic attacks. They come out of the blue, and suddenly the person their heart is racing, pounding, they're sweating, they're hyperventilating, they're just totally afraid. And yet they have no idea why they're so afraid. All right, and so a lot of times they think either I'm going crazy or maybe I'm having a heart attack because of what's going on inside of my body. So that typically accompanies PTSD. Depression accompanies PTSD quite often. And there could be a lot of issues around anger. You know, because again of having been violated in some way or having something that's very emotionally attached to oneself taken away. So anger, so there could be a variety of other disorders that do accompany PTSD. And so in the treatment mode, then you need to treat not only the PTSD, but you also then need to treat whatever other disorders are there as well.
I see. So if there's someone watching this, and often, you know, people would have, there's several types of symptoms that may be associated with other disorders or other conditions. But with PTSD, with all those symptoms, if a person has been experiencing from time to time those symptoms, but may have not known, they should, I guess, be evaluated for that disorder, but maybe have been trying to quiet the symptoms themselves or suppress them in some way. What would be then possibly some of the outcomes that would occur if, say, a person was using drugs or alcohol to suppress the symptoms themselves?
A lot of people do try to self-medicate, and they self-medicate for a variety of reasons. A caveat here is that PTSD tends to occur more in females than in males.
Okay, it's important to know.
Okay. And for a lot of men, unfortunately, seeking medical care is one of the last things that they wish to do, and particularly if it's mental health related care that they need, all right? So they will try as much as possible to deal with it themselves, and usually that's by using substances, whether it's alcohol or marijuana or some other drug, okay? Women also do the very same thing. They use a lot of alcohol, and it's just a way to try and just in some way make the symptoms just not as intense. You know, maybe this will allow me to sleep, because sleep disturbance occurs a lot with PTSD. Or maybe this will help me calm down. I won't be so nervous, or I won't be so anxious. So, yes.
So a person could actually exist in that state where they're using the alcohol or drugs to quiet the symptoms and get some relief or effect. What would then be a reason, I guess, what would heighten their awareness to say, maybe I need to get medical help or see a psychologist or a therapist?
Okay. All right. So the fundamental way that with any mental illness that the fundamental way that you would either refer a person or they would most likely refer themselves for treatment is they begin to realize that they're having trouble functioning.
Okay.
So they're not able to work. They are not able to take care of their children. They're not able in many ways to just carry out their daily activities. Because when you think about the symptoms of PTSD, I mean, if you're very on guard, it's going to be hard to concentrate.
Yeah,
you know?
I can see that.
If you're re-experiencing the actual event, that means you're going to have difficulty sleeping, paying attention. And in fact, when you have a flashback, you become unaware of your surroundings because you're totally back into that situation.
Taking yourself back to the situation, yeah.
So you begin to see very severe problems with normal, everyday functioning.
Okay.
And as a result of that, and then also with the feelings, that intensity of the anxiety, that intensity of the flashbacks, that's enough to bring the people in because they want some type of relief.
Sure. So speaking of relief, how would then a person that has been diagnosed, has had the symptoms for in excess of 30 days, what would be some treatments that that person could possibly, I guess, with therapy, not only therapy, but would there be therapy and medication maybe that would be prescribed for that person?
I think one of the recommended treatments is a combination of medications and psychotherapy. Okay, psychotherapy is the same as talk therapy. Okay, all right. As we said before, there's a lot of other conditions that may also be present, for example, depression or anxiety. So antidepressants, anti-anxiety medications would be one way that it's treated in terms of medications.
Okay.
If there is cognitive distortions, and sometimes in the extreme cases, there could be hallucinations. So antipsychotic medications would also be appropriate depending on, again, the severity of the symptoms.
Okay.
And then combine that with psychotherapy.
Okay.
All right. And one of the ways that I try to help people to understand why the two in combination are more successful, the medicines will help with some of the physical symptoms, ease a lot of that tension and anxiety. But it doesn't help you in the sense of being able to live with the actual trauma, because that traumatic event is still giving rise to that. And what the psychotherapy does is help you to begin to go back and re-experience the trauma in a safe way, so that you then learn how to deal with the feelings and the emotions that come up. So that's why the two work in tandem as a way of helping to relieve the symptoms. And usually that combination will take about 6 to 12 weeks treatment.
See. Okay. That's interesting, because what may sound like, I guess, a paradoxical, situation where you're saying to go back and relive, which is what they're really often trying to avoid.
Exactly.
So, but that is the way that you would treat them, is by having them go back to relive that in a healthy or positive way? How does that work?
Yeah, you don't want them to re-experience the trauma.
Okay.
In other words, you don't want to re-traumatize the person. So what you need to do sometimes is gradually expose them. So there's two main types of therapy. One is called exposure therapy, where you go gradually taking them up to the traumatic event. And during the time that you're doing the gradual movement towards the event itself, as the feelings come up, you're also teaching them how to deal with the feelings. So at each step. So let's say, for example, a person has a fear of heights. And that fear of heights came out of the fact that they were on the 12th floor of an elevator that then dropped in a building. So as a result of that, they're afraid of heights. So what you would maybe gradually do is something as simple as, are they comfortable enough maybe just standing on top of a table? I mean, that's, that's, and does that bring up any anxiety or in the feelings? And if it does, now let's teach you how to deal with those right now.
I see.
Right?
Okay.
And then gradually now you you put them on something a little bit higher. And so gradually you get them up to a place where they've learned it's okay to be in a high place. And when I'm there, if symptoms come up, I know how to deal with those symptoms.
Okay. So you're like reinforcing their ability to manage the symptoms as you escalate the exposure back to ultimately getting to something closer to what they experience.
Exactly.
And I could see why they would obviously need a professional to do that, because at any of those intervals they can relapse or go back into experiencing those. So that's really interesting. I can see also why this is something that is needed. There seems to be an escalation in people that are experiencing the PTSD symptoms, because you mentioned about the mall shootings, the mass shootings that's occurring. Unfortunately, there's a lot of violence, especially during the warmer months in our city. So we're hoping that doesn't continue. But if you know of, or if you yourself have experienced any of these type of situations that has been discussed, you can feel free to contact Dr. Scott, or also you can contact us through Midlife by Design. Dr. Scott also, by the way, is an affiliate with Midlife by Design, in addition to having his practice in the Central West End, which we're happy to have you join us as an affiliate. This brings a lot of experience and expertise and knowledge to what we offer as a counseling agency. So, Dr. Scott, with the treatment then, how long, just to wrap this up, if a person is consistently having the treatment, you mentioned something, was it 6 months or weeks? I'm sorry.
Typically 6 to 12 weeks. 6
to 12 weeks. Is there a place where they can finally be absolved of or cured of all the symptoms and get back to a normal state of living?
For some people, yes.
Okay.
But I do need to say, depending again on the type of trauma, and sometimes people are re-exposed to trauma, so they have what we call complex PTSD, because let's say that as a child they were abused over the years, physically or sexually abused. So each of those abuses just adds and compounds and makes the symptoms that much stronger and harder to resist. So something chronic like that, they may not be able to totally come out of, but they may be able to learn how to live with it. So you can have PTSD chronically for the rest of your life, depending on
see.
the type of trauma that you have experienced and the frequency with which you have.
I
And then
see.
one other caveat too is usually the symptoms will come about 3 months after the traumatic event. However, they can lie dormant for years. And then something happens that triggers them, and that's when they begin to surface.
Because they've never been processed through when it first occurred. Makes sense. Okay. Well, this is a topic again that we could possibly go on and on with, because there's so much, and there's so much history behind the development of PTSD, and there's also a lot more about treatment and the symptoms that we just with time we just don't have the time to get into everything. But Dr. Scott, of course, will return again, and we will discuss other topics that I feel our audience have maybe asked or questioned us about at Midlife by Design, or may be interested in. But until then, this is Carolyn Catchings and Dr. Scott, and we're just reminding you to not attempt to take your path of mental health wellness alone. Ask a therapist. Thank you again.
Thank you.
For coming and helping us out here. Appreciate it. This program was brought to you by Midlife by Design. Our mission at Midlife by Design is to continue to provide our community with empowerment tools for personal growth, change, and development. Your contributions would be greatly appreciated to help support this cause. Please visit our website at www.midlifebydesign.org or call toll-free at 1-800-413-3057. We look forward to hearing from you. Thank you.